Doctors, what made you say, "How the fuck are you still alive?" An unlucky lucky guy forgot his keys and was climbing back into his own apartment through the window. His cousin friend thought that he was an intruder and pointed a gun at him and pulled the trigger as the unlucky lucky guy opened his mouth to say, "Don't shoot." The bullet went into his mouth and clean exited the back of his neck. After surgery, he was totally fine in a few days. Somehow missed all major structures. Didn't even chip a tooth. Really pissed at his cousin from my neurosurgery rotation in med school. A guy I know with cancer smokes 2 packs a day and drinks a 1/5 of Fireball every day. He lives in a trailer so dirty, there's a 1/2 inch of dirt, according to his wife's mother. He recovered from surgeries in that trailer. Eventually, we got word he was quitting chemo and was just going to accept death. 5 years ago, he was given 2 months to live. He is now completely cancer-free. Life is just weird sometimes. When I was in college, there was a kid that exited a freeway at near freeway speed. Problem was, it was a construction zone at night, no lights, and it wasn't supposed to be an open exit. Drove right into a pile of rebar. One of the poles went through the car into his face and pinned him to the seat through his head. A couple of years later, I was in grad school, in an anatomy seminar, and the surgeon presented that kid's case as a study. Not only did he live, the rebar had slid right past the base of the brain/spinal column. It was so close, they had to twist it out like a screw because the ribbing on the bar threatened nerve damage. They literally rebuilt this kid's skull around his brain. His recovery photo was a totally normal kid smiling. He had a small scar on his chin. I say kid, but he was like 17, just to be clear. This guy, one of my prior patients, is a roofer who lived a very full life of alcohol, women, and drugs. He was infected with HIV, hepatitis B, hepatitis C, and was cirrhotic and didn't really care about his health at all. He was ghostly thin and weighed 110 pounds on a 6-foot frame, which included 20 pounds of ascites in his abdomen. He was angry and didn't listen to anyone, refusing therapy most of the time. I met him first in the ICU, where he had full-blown AIDS, end-stage liver disease, hepatorenal syndrome, unexplained lymph nodes all over his body, variceal hemorrhage, Kaposi's sarcoma, and spontaneous bacterial peritonitis. Prognosis of in-hospital death was 90% even with therapy. I was involved in his care for about 2 weeks, and again, he refused every therapy that his primary physician suggested. I was surprised he lasted the 2 weeks. Finally, he was so fed up of the noisiness in the ICU that he requested transfer to palliative care and was eventually sent to a hospice for patients with advanced HIV to live out his remaining few days. 1 year later, I get a call from the hospice requesting a follow-up appointment for him. I was shocked that he was still alive and asked if I could talk to him. He was all better. Turns out, he had the hots for his nurse in the hospice and did everything she asked in order to please her, including taking his medications for the first time. She had slowly nursed him back to health, convinced him to restart HIV meds, put him on a low-salt diet for his liver disease, and then eventually got him up and mobile. He spent another 6 months in a rehabilitation facility, then went back to work. He saw me in follow-up for a while as we treated his hepatitis C. Then his cirrhosis shockingly improved. After a couple of years, he moved away to another place to start a construction company and became rather successful financially and remains abstinent on his former vices. He's the only person that I've seen come back from death. My resident called me urgently one night and said I needed to come to the hospital. A young man was cut in half by a train. I asked why I needed to come in. There was no way he could survive that. She explained that somehow he was maintaining his pressure and wasn't bleeding out. When I arrived, I found that the force of train had sealed off all the major vessels from the pelvis down. 2 that stick out. Guy gets shot in the abdomen, drops to his knees. Shooter puts one through the top of his head near his forehead. Bullet exits through his jaw. He wouldn't stop complaining about how much he hates the guy who shot him. Young girl driving a car gets T-boned on the passenger side by an Altima going at least 70 miles per hour. Her car looks like it was hit by an IED, so we assumed she was deceased upon arrival when the other crew on scene said our focus was extricating the people in the Altima. Girl driving was completely unhurt by a Volvo. Kind of a retelling, but one time a cadaver on which I was performing an autopsy had a lung which was flipped upside down. When I tried to flip it to the proper position, bloop, it flipped right back to upside down. After some due diligence, we realized the lung was a transplant, and the surgeons who performed the transplant had attached the organ incorrectly. The lung had been fighting to be upside down its whole life in this other man. After 15 or so years, the man eventually moved in a way that allowed it to flip over, resulting in his death. Not really a how the fuck is this person still alive, but more of a how the fuck did this person live this long with this condition. Had a lady walk into the hospital with her face pointed at her chest. Her C1 vertebra had somehow fallen off C2, with her spinal cord delicately draped across the odontoid process. No damage to anything. Repaired with slow traction and a halo for a little while. Still baffles my mind 5 years later. Older woman called 911 for chest pain. Her vital signs were shit, and she had the look that anyone who's ever seen a patient about to die will recognize instantly. Her EKG suggested multiple blockages in her coronary arteries, and we had to put her on a ventilator shortly after she got to the ER because she deteriorated so quickly. Cath lab confirmed the EKG findings: complete blockage of one artery and 99% blockage of 2 other major arteries. Unfortunately, it was too extensive to resolve with PCI, so the only option was to fly her to the university hospital in the city for an emergent triple bypass. It turned out that she'd had multiple episodes like this, but not quite as severe, over the last 6 months, and had refused bypass surgery not once, not twice, but 3 times in favor of a Mediterranean diet. Well, at this point, she didn't have much say anymore, and family agreed, so off to the OR she went. I took care of her again about 4 months later, and she actually seemed to have made a remarkable recovery. As a student, had a young guy come in who self-inflicted 22 to the inside of his mouth and passed out. Awoke the next morning, didn't recall the night prior, went to work. 2 hours into work, he says he's not feeling right and starts acting odd. Coworkers call EMS. They take him in, and while the ED is working him up, they notice a mix of clear fluid and blood in the back of his mouth. They call ENT and get a CT head. Shows 11 or so bullet fragments throughout his noggin. The guy was acting by that time completely unfazed. I was very fazed. Working in an Aboriginal community, a woman walked in complaining of a headache behind her eye. She was told to take a seat, and as she turned around, she had a butter knife sticking out the back of her skull. Apparently, a drunk relative came home and stabbed her while she slept. I helped take care of an old dude who had one leg amputated and had broken his other leg, so he was seeing us because of that. He was on oxygen and not being very compliant with using his wheelchair. We were talking with him, and he was getting really argumentative. "How am I supposed to chop wood in a wheelchair?" was what he kept demanding. When asked how he was chopping wood with one leg in the first place, he responded that he'd crawl into the woods and hop up to chop the wood. This was even more concerning. When the doctor asked how he was carrying his axe, oxygen, and the wood he chopped, he looked him straight in the eye and said, "I carry him on my back." Not sure if he was serious, but he was pretty dang grizzled and looked like he may have been crawling through the woods. Any of the patients with flesh-eating bacterias and massive debridements, those are always a good source of what the fuckery. Not a doctor. A classmate of mine in HS was out snowmobiling in the middle of the night. He was going about 50 miles per hour down a trail. Some asshole had put a chain across the trail just to be an asshole. He didn't put reflectors on it, and it wasn't even on his own land. It was on state land. Unfortunately, my classmate had a backrest on his sled. The chain hit him square across his chest. It slammed him into the backrest, which fortunately broke off. He rode back home and crawled into bed. Later, his mom made him go to the local clinic that had a small ER. They life-flighted him down to Duluth immediately. He had a ruptured spleen. Part of his liver was torn. His heart was badly bruised, and he had a collapsed lung. He was bleeding pretty bad internally. The doc told him that if he hadn't been so muscular, he would have died out on the trail. The man was about 6 feet and 245 pounds and ripped like a bodybuilder when he started. 6 months and a bunch of surgeries later, he was maybe 130 pounds. He looked like death, and his whole chest was railroad tracks. They had to crack his chest twice to deal with his heart, and opened up his abdomen numerous times to deal with infections. Now, he's the same loud, crazy person he always was, a successful business owner with a wife and kids. Everyone thought he was going to die, including the doctors, but he pulled through. For me, it was a guy who was cleaning his loaded shotgun, and it blew half his face off, jaw and all. He was actually pretty good from the mid-nose up. The thing that surprised me is how good of shape he was in afterwards. He didn't even go to the ICU. We just admitted him to the med den surge floor. He was up communicating via whiteboard within a few hours and was adamant that he did not try to kill himself. Got a psych consult anyway, but they agreed. Another inch dorsal with the barrel of that gun, and he would have been done for. You know those big 16, 18-inch kitchen knives that everyone has? Had a lady come in with one sticking sideways out of her neck, handle on the left side, and top sticking out the right. She went to OR, where they removed the knife in one of the most tense, asshole-clenched moments in history. Minimal bleeding. Apparently, the knife split right between her major blood vessels and airway, was lying right against them, didn't scratch them. Absolutely incredible. Infantry guy in Afghanistan in 2009. Some old guy came up to us in a bazaar and asked us to give him a ride to a city. His arm was wrapped up. We said no, since we don't exactly do that. He unwrapped his arm. His hand wrist was missing, and his 2 arm bones were exposed in white. Everything else was green and black. I have no idea how he was alive, much less up and walking around. Work in a hospital. A guy showed up who had burst a tire going 180 kilometers per h and flipped his car multiple times. His car was a write-off. The only injuries he got were a few scratches and a bruise. I'm not a doctor, but I was diagnosed with Addison's at age 13 or so. Was just generally feeling lethargic, vomiting, dizzy. Mom calls the hospital with symptoms, and they said if I had all 3 at the same time to come in to be safe, orderly, or whatever. Checks my pulse in the lobby. 30/15ths. He laughs. Well, this one's broken, and gets another machine. 30/15ths. Wait, what? Calls a doctor. They double check it and run me to the ER for fluids. Again, not a doctor here, but apparently that's not even high enough to have a pulse. They had no clue how I was walking, let alone conscious, but saw the numbers, and after realizing it was accurate, they freaked the hell out. And of course, that freaked my mom out. Them telling my mom 30/15ths is the BP of a dead person did not help. And then they said it's either autoimmune or cancer. My immune system apparently ate my adrenal glands. Now I'm on meds for life. Lucky me. On the bright side, though, I never really have to worry about high blood pressure. My dad walked a mile to see a friend and tried to walk up the stairs. Couldn't get up 1 step. Walked back 1 mile to his office, looked up who his doctor was, since he hadn't seen one in 20 years, and drove there. No appointment. Doctor hooks him up to an EKG, but it's fine. Tells him there's a cardiologist next door. It's the end of the day. They'll see him, just in case. They hook him up to a blood pressure monitor while he's on a treadmill. The monitor's behind him. He can't see it. He starts walking. They set a countdown timer for 3 minutes, and about 30 seconds in, one of the nurses steps out of the room. My dad is watching the timer, and it counts down to 0. He feels fine and figures he's going home, but the door opens, and 2 ambulance attendants are wheeling in a gurney. While he was on the treadmill, his blood pressure dropped to 0, then restarted, then dropped to 0 again. The nurse who stepped out of the room dialed 911. They let him finish because they figured as soon as he stopped, the heart attack would start in earnest. Quadruple bypass later, and he lived. But note, he said he never felt the same. A bypass is not a panacea.